Hi, everyone. My name is Carolyn Savage, and I'm a respiratory therapist with the Connect Well Lung Health and Rehab Program. Today's presentation is about pulmonary hypertension. The objectives of today is to understand normal pulmonary circulation, understand what is pulmonary hypertension, hopefully get a better understanding of that, and also have a better understanding of the cause and symptoms relating to this disease. So when we think of normal lung anatomy, I'm just going to try and get my picture out of the way here. Beginning at our mouth and nose to our throat is considered the upper airway. At our trachea or windpipe, the airway goes between our vocal cords and branches into two bronchi to enter the left and right lung fields. The lungs are made up of several different sections of lobes, and the airways become smaller and smaller as they go deeper into the lungs, ending at air sacs called alveoli. We all have billions of alveoli within our lungs, and these air sacs or alveoli are surrounded by capillaries or very small blood vessels. And so really it's at these alveoli, and with the help of the capillaries is where the gas exchange occurs. We always have some percentage of oxygen and carbon dioxide in our blood as a baseline. And as we breathe in, of course, we're breathing in good amounts of oxygen, which every body system needs. And as we exhale, we're exhaling the carbon dioxide, which is a waste product as the body uses the oxygen. So normal pulmonary circulation, pulmonary, of course, referring to the lungs, and circulation referring to the blood flow through the lungs. The main role of this system is the exchange of gases, the exchange of that carbon dioxide and oxygen. So the path of pulmonary circulation really starts at the heart, where the right ventricle or the bottom right heart chamber pumps the blood that is coming from the rest of the body. This blood is low in oxygen because the body has already used it or picked it up, and higher in that carbon dioxide. The right heart pumps it into the pulmonary system, that pulmonary circulation from the pulmonary arteries. It flows to the smaller pulmonary capillaries, which surround those air sacs. Gas exchange happens, and now the blood is oxygenated. This oxygen-rich blood then flows back to the heart through the pulmonary veins, where the left ventricle pumps it to the rest of the body for the rest of the body to use that oxygen. So normal pulmonary circulation is very fast. It takes only 4 to 5 seconds for the blood to travel through the pulmonary circulation when a person is at rest. Of that, the blood really only spends about 0.75 of a second, so very fast, in the capillaries, which is where that gas exchange happens. In order to work as efficiently as possible, the pulmonary circulation is normally a low pressure system that has high flow of blood volume, so low pressure, high flow system. Pulmonary hypertension really refers to the blood pressure within the pulmonary arteries becoming a high blood pressure system. So it's often caused by narrowing or closing of the pulmonary arteries for some reason. The narrowing of the blood vessels leads to more resistance in blood flow, and this can result often in less oxygen being able to be picked up from those air sacs, but also putting great strain on the right side of the heart, that right ventricle, which is pumping the blood flow into the pulmonary system. Pulmonary hypertension then means that the pulmonary circulation has somehow changed to become a high pressure and low flow system. So the causes of pulmonary hypertension can be many. We know that there are 5 different types of pulmonary hypertension, and anyone of any age can develop this condition. We also know that pulmonary hypertension can develop or is more likely to develop when somebody has a chronic health condition of some kind. So some of the most common underlying causes can be congenital heart disease or heart disease that is present at birth, lupus or coronary artery disease, liver disease, some liver diseases, blood clots in the lungs can sometimes develop into a pulmonary hypertension if they're there for quite a long time. Emphysema or COPD, people with sleep apnea can sometimes develop pulmonary hypertension, and genetics can also play a big role. The symptoms of pulmonary hypertension really vary person to person. There are some people who have mild pulmonary hypertension and may not have any symptoms at all. But usually people who have moderate or severe pulmonary hypertension notice shortness of breath, especially with exercise. Other symptoms can include an unusual chest pain or a heaviness in the chest, symptoms of a right-sided heart failure. So often that can mean swelling of the feet, ankles, or legs, sometimes more of a cough, lightheadedness or fainting, heart palpitations, blue fingers or toes. So evidence of low oxygen that can come with pulmonary hypertension. Often heart failure is very, very common for people who have the more moderate to severe pulmonary hypertension because of the strain on the right side of the heart. Because the symptoms of pulmonary hypertension are really very similar to other symptoms of other conditions, including lung conditions, it can take time to accurately diagnose pulmonary hypertension. Without treatment, however, the average life expectancy, once if not diagnosed, is less than 3 years. There are a number of treatments for pulmonary hypertension which work to slow the progression of the condition and minimize symptoms. So first, getting a good diagnosis is important, and it's extremely important to be referred to a specialist for pulmonary hypertension once the diagnosis is received. To assess for pulmonary hypertension, some of the testing may include an echocardiogram or an ultrasound to check on that right side of the heart in particular. It will measure the pressures within the lungs, the pulmonary system, and measure the size of those heart chambers. Certainly, if there's stress on the right side of the heart, the right ventricle will become enlarged. An ECG is an electrocardiogram, gives a picture of the electrical activity of the heart. Spirometry, as shown in the top left, is a measurement to see how the lungs are functioning. And again, thinking of the shortness of breath and chest tightness, they're very similar to lung conditions. A 6-minute walk test can measure if the oxygen levels are changing with exertion. And sometimes a sleep assessment is part of the assessment for pulmonary hypertension and determining the cause of the pulmonary hypertension. Pulmonary hypertension is treated by several medications, although there is currently no known cure for pulmonary hypertension. Treatments are specific for each person who has this condition, and often and only treated by being followed by a specialist. Medications which target the pulmonary circulation are often part of the treatment. So medications focusing on narrowing, relaxing the blood vessels and dilating the blood vessels. Diuretics to minimize how much blood fluid is being pumped into the pulmonary circulation. Oxygen, if the oxygen levels drop with exercise. Pulmonary rehab is important because it helps the body use the oxygen much more efficiently. And in more serious cases, a heart or lung transplant might be considered. For more information on pulmonary hypertension, please do go to the Pulmonary Hypertension Association of Canada website, which has the most up-to-date information and many, many resources. The Lung Health Foundation also has good information about pulmonary hypertension in general, as does the Ottawa Heart Institute. Googling, of course, pulmonary hypertension. Just do watch your sources of information, making sure that they're the most accurate. Thank you for joining me. If you want more information on this or any other topic relating to heart or lung health, please contact ConnectWell Community Health. Again, I'm with the ConnectWell Lung Health and Rehab Program.